Great. So we're recording this. It's January 8th, 2026. And my name is Jim Brikita. I'm the managing director, as I said, of health services here at the Entertainment Community Fund. And this is the webinar about finding affordable coverage in New York and New Jersey. So welcome, everyone. Thanks for coming. The presentation lasts probably 45 to 50 minutes or so. I go a little quickly, but save your questions. We'll do a Q&A at the end. We will not record the Q&A. We'll stop the recording at that point. Just a little about who we are, right? The Entertainment Community Fund for many years was called the Actors Fund for about 100 years. We are a comprehensive national human services organization that helps everyone in the entertainment industry. So we have a whole suite of services that we offer here. We do financial assistance. We do, of course, this health insurance and Medicare and Affordable Care Act insurance counseling. We run a primary care facility here in Midtown Manhattan. We have the Actors Fund Nursing Home in Englewood, New Jersey. We also do career counseling. We have support for seniors, support for kids. We have support for affordable housing, and we run affordable housing units and buildings here in New York and in California. So we do a lot of stuff. Worth it to check us out on the website if you want to see other stuff, other webinars like this and workshops on financial wellness, etc. All part of the mandate of what we do here at the Entertainment Community Fund. We in health services have our own webpage. The webpage is listed at the bottom of this slide, entertainmentcommunity.org/AHERC. AHERC stands for Artists Health Insurance Resource Center, AHERC. And on our page, you'll find, educational online materials, some tutorials that are there, other little, maybe a link to this video once it's recorded. We do this webinar bi-weekly. We do one in California bi-weekly. We do a Welcome to Medicare webinar for people turning 65 or over 65. And a lot of what we do here on our team is one-on-one insurance consultations. So if you need a one-on-one consultation with a benefits specialist, please go through. You have to set up a username and password on our website, request an appointment, and you'll get connected with a counselor. We also do a fair amount of advocacy work in the legislative arena, especially with regard to the COBRA subsidy program, which I'll talk about in New York State, and other sort of health justice and health equity stuff. So what we're going to start with is a little health insurance vocabulary. We'll go through this first just because these terms, throw a lot of folks. Once we do this, I'll talk about what your options are now. You've obviously come to the webinar because you're interested in insurance, or you're losing your insurance, or you might be losing your insurance, or thinking about what you're going to do, and we'll talk about that. And I'm also going to talk about some of the legislative changes that have happened at the federal level and how they're impacting folks in New York. But just some basic terminology first. The words on this screen all relate to a health insurance policy. So when you have health insurance, you have to pay a monthly fee. That monthly fee that you pay for the pleasure of having health insurance is called your premium. Also, when you get a health insurance policy, almost every policy has a deductible. A deductible is an amount of money that you're responsible for, right? You're responsible for paying for medical services up to a certain amount of money before the insurance plan starts paying for anything. That's your deductible, right? So if you have a $1,000 deductible, your first $1,000 of medical services in the calendar year are your responsibility, and then the health plan starts paying its portion. Some policies have a copay. A copay is a flat fee that you pay at the doctor's office or at the pharmacy in order to access the service. This might be as low as $15, $20. It might be as high as $60 or $75, depending on the policy. Coinsurance is the one that I think throws a lot of folks. Coinsurance is the percentage of a bill that you owe even after you hit your deductible. So in the example above, if you had your a $1,000 deductible, after you spend down $1,000 on medical services in the calendar year, and then you go to the doctor, you may still owe a portion of the bill. Sometimes the plan will pay 60% of the bill, and you're still on the hook for 40%. Some plans pay 70%, you're on the hook for 30%. It's always expressed as a percentage, coinsurance, but it's your responsibility. That's your cost out of pocket. All plans also under federal law have to have what's called an out-of-pocket maximum. Out-of-pocket maximum is the most money you would spend in a calendar year before the insurance company has to pay 100% of all charges. The out-of-pocket maximum is set by the government. This year, last year it was $9,425. This year it's close to $10,000. But really it's kind of a catastrophic protection. If you're hospitalized, once you reach $10,000 in your cost sharing, they would cap that. You wouldn't be responsible for any more than that. Words on this page are related to the what's called the marketplace, or the Affordable Care Act marketplace. Let's do that one first. The marketplace is in the middle of the page here. The marketplace has a dozen different names. People call it all sorts of things. They call it the Affordable Care Act. They call it the Obamacare. They call it the Exchange. They call it healthcare.gov. In New York, it's called New York State of Health. In New Jersey, it's called Get Covered New Jersey. In Connecticut, it's called Access Health Connecticut. It's all really the same thing, right? We call it the marketplace. On the marketplace, they use an income scale created by the federal government called the Federal Poverty Level Income Scale. The federal poverty level is, people think of it as what the federal government thinks is poor, and I guess you could think of it that way. But it's really a tool. It's an income scale that they use to determine who's eligible for benefits. Right now, the federal poverty level for an individual is $15,650. So $15,650 is what's effectively known as 100% of the federal poverty level. If you're an individual and you make double that, you'd be at 200% of the federal poverty level. And often for government benefits, depending on where you fall on that federal poverty level scale, you might be eligible for certain discounts or programs. That's what that is. And we'll mention that a little bit more in the future slides. The advanced premium tax credit is a fancy word for a discount. It's a discount that you can get off your monthly health plan premium on the marketplace based on your income. So when you file an application on the marketplace, you declare your income. Based on the income you declare, you may be eligible for a discount off your premium. This was the thing that was in the crosshairs of the federal government and that caused the government shutdown a few months ago, because these discounts had been expanded by the previous administration. They've been now reduced again, and there's been a lot of tension in the government about the viability of that. Couple of other terms. This is my last slide on vocabulary, and then we'll get into it. These are sort of words about your health plan, right? Often we talk about whether your doctor is in network or out of network. When your doctor or your doctor's office or the hospital accepts a certain insurance plan, they're said to be in network with that insurance plan. Sometimes they're said to be participating with that insurance plan. Some plans allow you to see both in and out of network doctors. Some plans force you to be in network in order to get their services covered. And the kinds of plans are listed below here, right? So that first one, an HMO, a health maintenance organization. In a health maintenance organization, you have to use doctors in your insurance company's network to get the services covered. If you use an out-of-network doctor, you're paying full price out-of-network for that doctor. You're paying out of pocket, rather, for that doctor. You also, in an HMO, have to have a dedicated primary care physician who has to be in network. And if you need to see a specialist, you have to get a referral from that primary care physician before you see the specialist. So there's really, it's called a gatekeeper plan sometimes, where you have to, somebody's managing your care. That primary care physician is directing your care in a hands-on way. The opposite of an HMO is that last bullet point, which is a PPO. A PPO is very flexible. It allows you to see any doctor you want, right? You can see both in and out of network doctors. You save money if you stay in the network. They incentivize you to stay in the network. But you're able to see an out of network physician, and if you file a claim, you'll get a reimbursement or a partial reimbursement for that visit. The word in the middle, the initials in the middle, the EPO. An EPO is really an HMO, but it gives you an extra perk. And the extra perk is you don't need that referral from the primary care physician. So there are some plans on the New York marketplace and the New Jersey marketplace that operate as EPOs, they're a little more attractive because you have a little more flexibility in who you can see. All plans on the New York marketplace and the New Jersey marketplace are HMO or EPO plans. There are no PPO plans on the New York or New Jersey marketplace. So some general rules about the marketplace for 2026. First of all, you can't be refused coverage, right? It's called guaranteed issue insurance. Everyone's eligible. They can't exclude pre-existing conditions. That's not a thing anymore. That was done away with in the Affordable Care Act in 2010. There's no penalty for being uninsured in New York. However, there is a penalty in certain other states. When the Affordable Care Act first started, there was a tax penalty if you went uninsured. They were trying to get everybody in the country insured. There was some debate about that and litigation about that, and it finally went away. What was called the individual mandate finally went away. But there are states in the country that still retain that tax penalty. New Jersey is one of them. California is one of them. And the other ones are listed here. If you go more than 3 months without coverage in these states, you will pay a penalty on your federal tax return. All plans on the marketplace have to cover preventive services for free. So annual wellness visits, you see the list here, screenings, vaccines, testing, all this stuff is covered for free. So your annual wellness visit would be covered for free. The difficulty here is sometimes a wellness visit will turn into what's called a diagnostic visit. Think of you go in for a colonoscopy and they find a polyp. It started out as a wellness visit, as a screening, and all of a sudden now it's a diagnostic visit because they're doing something. They're doing a minor surgery on you, and you may be on the hook for costs in that case. So that's a little nuance there, but they have to cover preventive services for free. There are 10 essential health benefits mandated under the Affordable Care Act. All plans on the Affordable Care Act must cover these things. It doesn't mean they cover them for free, but it means they have to be part of the policy. So you see them here: PT, rehab services, drugs, hospitalization, maternity, pediatric, all that stuff has to be covered in your policy that you get on the exchange. So there's been a lot of concern lately about what's happening at the federal level and how it's going to impact states and how it's going to impact people moving forward. I'm just going to make some general comments here. Some of this is a bit of a moving target, so some of this is still in flux, but I'll just talk about sort of what's happening right now in January 2026. In July of 2025, Congress passed a bill called H.R. 1. It was also called the One Big Beautiful Bill Act, the OBBBA. Eventually, this is going to make insurance harder to get and harder to keep and more expensive. That's really going to be the effect of it. The most drastic changes that are happening to Medicaid especially won't be happening until later. They front-loaded a lot of the sweeteners in the bill, things like tax cuts and stuff, and they pushed a lot of the very negative stuff off until 27 and 28. So right now, for people who are renewing their coverage into Medicaid or what's called the Essential Plan in New York, which I'll talk about, most of those renewals are going pretty smoothly. There's been some hiccups, but it's mostly been status quo for right now. We don't expect that to stay. We expect more headwinds moving forward. One group that's really in the crosshairs of this law are immigrant populations, including people on artist visas. They're going to face some serious challenges as we move forward. Sorry, I just heard a bling in my, oh no, we're still on. The most immediate one was the DACA recipients, people who are here on what's called Deferred Action for Childhood Arrivals. They were no longer eligible for discounts as of August 2025. So just specifically what's happening this year and next couple of years, those tax credits, those discounts that people were getting off the monthly premium, they were expanded during the last administration. They're being reduced now for 2026, and it's making premiums much more expensive for people who are getting a discount. There also is a cap now on income. So once your income goes over a certain amount, you are no longer eligible for a discount or a subsidy on the Affordable Care Act. That discount is capped at the income is capped at 400% of the federal poverty level, which for an individual is $62,600. So things are getting more expensive. We are expecting more stringent income documentation requirements. So when you file an application, sometimes they ask you to prove your income. For people who are freelance or sporadic income workers, like people in the arts, these documentation requests are probably going to get a little heavy, present more of a heavier burden moving forward. Also, next year, we just passed, or we're just at the end here of open enrollment this year. But for next year, in November next year, when open enrollment starts, the open enrollment periods to renew coverage are going to be much shorter. I think we're going down to 7 or 8 weeks next year rather than 3 months. For Medicaid, and again, we'll talk a little more specifically about what Medicaid is in a few minutes. Medicaid recipients will be facing work requirements starting in 2027. It's not quite clear who exactly is going to be subject to the work requirements. Also, states can apply for an extension of the work requirements to 2028. New York has already applied. I think New Jersey has as well, and California has as well. The state has to be making a good faith effort to institute work requirements or volunteer requirements. The work requirement issue is that you would have to work 80 hours in a month or volunteer 80 hours in a month in order to retain your Medicaid status. You'll also have a biannual certification for Medicaid. So you're going to have to recertify twice a year in order to retain Medicaid. So what can we do about all this? The best thing to do is pay attention, right? Know what your coverage is, know when it starts and ends. Please rely on us for accurate information. We update our website. You can meet with one of our health insurance counselors to figure out your options and go over what's going on. There's also some other resources we suggest. The Kaiser Family Foundation is terrific. They're a nonprofit, really reliable, straight shooting news source for health information. New York State of Health also has a Stay Connected webpage, which they update regularly, and that has been a pretty good resource as well, especially for people here in New York. So if you're uninsured or you're losing insurance or you want to know what your options are, what are they right now, right? If you've had coverage through your family, from a job, from a union, you're going to be offered what's called COBRA, and I'm going to tell you what that is in just a second. You may be able to go on COBRA. You also can call an insurance company and just buy a policy. We don't recommend that, but you could do that. You can call up an insurance company and buy a policy directly from them. More likely, you're going to get coverage from what's called the marketplace, and I'm going to discuss in detail how that works. In the marketplace in New York, you can also enroll directly in Medicaid or the Essential Plan. In New Jersey, it's a little bit different with Medicaid. So that first option, COBRA, if you had coverage through a job or a union or a family member and you lost that coverage, COBRA is a law that lets you keep that coverage, the same exact coverage you have now. You have the federal right to keep that insurance for at least 18 months. Some unions and employers will let you keep it longer, but it's at least the federal law says you get to keep it for 18 months. You have 60 days to opt into your COBRA. And once you opt in, you have 45 days from the day you opt in to pay your premium. Once you opt in, though, you have to back pay the premium to the day you lost coverage. So if you wait 2 months to join COBRA, you still owe that first month's, you have to go back 60 days and pay the premium from when you lost the coverage. The problem with COBRA is that it's often very, very, very expensive. That's why a lot of people don't take COBRA. As an example, Actors Equity uses their health fund is called the Equity League Health Fund or Health Plan. Their regular active premium is $300 a quarter, so $100 a month. The COBRA rate for Actors Equity this year is above $1,140 a month. So it's a serious spike in premium price. Luckily, in New York, if you're a resident of the state of New York and you work in the entertainment industry, New York has a COBRA subsidy program for people in entertainment that is actually pretty amazing. If you're eligible, it will give you a 75% discount off your COBRA premium. So some of the eligibility criteria are listed here. You have to live in New York. You have to be losing your insurance from an entertainment industry union health plan. You have to meet a monthly income requirement. That's the tough one. And you see the chart on the bottom here, which I'll go through. You also cannot have any other employer coverage or Medicare. The income is the monthly income in the month before you apply. So if you're applying in January and you're using your December income, if you're an individual and your income in December was less than $5,217, you'd be eligible for a 75% discount in your COBRA rate. So it's a very strong program. I encourage people to apply if they can. The application is on our website, or you can shoot me an email and I can send it to you. So that's option one. Option two, buying directly from an insurer. You can do this. The problem with doing this is you're not going to get any discounts from the insurance company itself. You're going to probably get a discount on the marketplace, but you're not going to get a discount from the insurance company. And you're going to get, there's not going to be as many options directly from an insurer. They're going to sell you an off-the-shelf product. On the marketplace, at least you're going to have some options. You'll have different levels of coverage that you can buy. An insurer is just going to sell you what they have. Also, if you're going on and you're shopping for insurance online, just please be careful. There are a lot of unsavory sellers out there peddling what look like insurance. They're not. We call them junk insurance here. I have another slide on this. But we've had a number of people get sort of scammed into crap insurance, and please be careful. If you're going to work with somebody, you can work with an agent or a broker. They're not bad people, but they do work on commission. They have an incentive to sell one company or another to you. We suggest you work with either a navigator, what's called a navigator, or an assister. These are people who are certified to give you accurate, objective advice, and then you make the decision about which policy you'd like to join. We're all navigators or certified application counselors here at the Entertainment Community Fund. Junk insurance plans, sometimes they're called meta-share plans or community-based plans or faith-based plans, short-term plans. These are not real insurance. In fact, short-term plans are illegal in New York and New Jersey. They are legal in some places, but they're not legal here. You may see cheaper prices, but the difficulty is these are not regulated products, so they don't have to comply with the Affordable Care Act, which means they can assess you for pre-existing conditions, they can refuse you coverage, they can sort of carve out areas of coverage. Common areas that they carve out are they won't cover things like family planning or substance abuse and mental health coverage. Those are common areas that they cut out. They also say things like there's a membership fee. You have to join the group, and then there's a membership fee, or they offer discounts up to a certain amount. These are not real insurance. I saw a policy the other day. I looked at the policy, and then on the bottom of every page, it actually said, this is not insurance. So please, read what you're buying. Come to us. We can go through things with you and tell you if it's a real plan or not. So most likely you're going to wind up on the marketplace. This is the homepage for the New York State of Health marketplace. This is the homepage for the Get Covered New Jersey marketplace. When you go on the marketplace, you file an application. And the way it works is they look at two specific things about you. So the first thing they look at is what they call the size of your household. They don't really exactly mean that. What they really mean is the way you file taxes. But it's so if, for instance, if you are single with no dependents, you're a household of one. If you're married filing jointly, you're a household of two. Sometimes households get complicated if there are broken families or combined families, but generally it mirrors your tax filing status. They look at your house, the size of your household, and then they look at your income. Right now we're looking at income for 2026. Sometimes we can look backwards at a previous year and use that as a guideline, but generally we're looking at the current year. So we're projecting our income for 2026. And then once it knows these two facts, the size of the household and the income, it puts them together and it puts you on a scale, an income scale, that federal poverty level income scale, and it will determine whether you're eligible for certain subsidies or certain programs to help you find and afford health insurance. Excuse me. So when they do that, they're going to put you in New York. They put you in one of three places, right? You're either going to be eligible for Medicaid, which is completely free. You may be eligible for the Essential Plan, which is a very low cost insurance plan in New York, sponsored by the state of New York. Or you may be eligible for what's called a qualified health plan. The qualified health plans are all named after metals: bronze, silver, gold. In New York, we add platinum, so bronze, silver, gold, and platinum. And if you're on a qualified health plan, based on your income, you may get a discount, which is that tax credit, or you may be paying full price for your coverage. When can you do this? In New York and New Jersey, we have something called open enrollment. Open enrollment runs from November 1st to January 31st. So we're still in open enrollment right now. You can still enter the system. You can still get into the insurance system or renew your coverage if you need to until January 31st. For states that use the federal website is healthcare.gov. That open enrollment is a little bit shorter, November 1st to January 15th. So that's going to end in just a week or so. Outside of this open enrollment period, you need a reason to get into the insurance system. The reasons are called qualifying events or qualifying life events. I'm going to show you a slide on them in just a second, but I just want to comment again that next year, these open enrollment periods are going to be significantly shorter. Okay, I think we're going to look at a 6 or 8 week open enrollment. We're not looking at a 3-month open enrollment next year. If you're outside of open enrollment and something happens, right, you have a reason to come into the insurance system, you're allowed to come in if you lose your coverage, for instance, or something else happens in your life, like you get married or you get divorced or you have a baby or you move to another state or a county. If your immigration status changes or you're aging out of your parents' plan or your family's plan, if any of these things happen, you have a 60-day window to go in and shop for and enroll in insurance. Other times or other things during the year where you can also navigate into the system without having to prove without having to have a qualifying event. If you're eligible for Medicaid, you can enter the system anytime during the year. If you're eligible for the Essential Plan, so those are 2 income-based plans, you can enter anytime during the year. If you're adding a child to the Child Health Insurance Program, which is a great program in New York, sometimes called CHIP, you can do that any time of year. And if you're buying insurance for a small business, those are all sort of wide open enrollment systems. If you need help doing this, you can always come to us. You go to portal.entertainmentcommunity.org. You have to get a username and password on our system, and then you can request an appointment with a counselor, and we can help you apply on the marketplace. If you're going to go on the marketplace yourself, you can go to New York State of Health or call them or get Covered New Jersey. You see the links here and the numbers. I'll share these slides afterward with everyone so you can have these things. If you're in another state, a lot of states have their own exchange, but when the Affordable Care Act started, a number of states objected to the Affordable Care Act, and so the federal government set up a federal website called healthcare.gov. So states, Florida, Georgia, Tennessee, and a number of other states use healthcare.gov. If you're going in on your own, please have all the data with you, right? You need name and address of all your employers. You need an accurate estimate of your 2026 income. Any immigration documents, you're going to want to have all that ready before you go in and fill out the application. So let's talk a little about calculating income, because in the arts, it can be challenging, especially if you have multiple jobs, multiple employers, you're working freelance, etc. So right now, when you go in and apply on the marketplace, you're going to be looking at your 2026 income, and you want to try to be as accurate as you can be, right? Which can be difficult if you're working in the theater or film and television. It can be tough. In New York, there is a tool you can use. On the application, they ask you to project your income, and you can sometimes use the adjusted gross income from your most recent tax return as a guideline. Your most recent tax return at this point would be the one you filed in April of 2025, which is really reflecting your 2024 income, right? So it's a little like, I don't know if anybody has gone through the college process lately with kids, they always base financial aid on the prior year. That's kind of what we're looking at in this, if you use this kind of a tool. If you think your income is going to be close enough to what you made on that last tax return, you may want to use that as a guideline, because if you use that income estimate, they may just base your eligibility on that particular estimate. It might be an easy way to complete the application. Otherwise, you're going to be building your income employer by employer, and you're going to enter all your W-2 income, gross income, right? Before tax income. So they want gross W-2 income. You can enter net self-employed income. So if you have a 1099 job, you can take expenses off that and use the net income for that, and any other sources of taxable income, right? You don't need to include gifts under $19,000, but stick to what you know you're going to receive. This is not about potential income. Oh, I might do a show in April, right? Oh, well, I think I'm going to make some residual money. I mean, they really want you to focus on what's guaranteed to happen in 2026. So it's case by case, and our counselors can help you do this. Couple of the different programs that you may be eligible for, right? I mentioned Medicaid a couple of times. Medicaid, funded by both the federal government and the state of New York. Medicaid is free. There is no cost to Medicaid. There's no premiums, there's no deductibles, there's no cost sharing of any kind. Sometimes there are very small, like $1 to $3 copays for certain prescriptions, but it's effectively a free program. It's given to you once you're eligible for Medicaid, you have it for 12 months. If your income increases, it says here you may be able to stay on Medicaid. They don't throw you off Medicaid. If your income increases, they'll let you run out your 12 months of Medicaid. If you get other insurance, they may change the kind of Medicaid you have, but it'll act as a secondary or backup insurance. In New York and New Jersey, you can apply through the marketplace. In New York, it's an immediate eligibility determination. They'll base it on your income and you get the determination. In New Jersey, once you file the application, they send you to a separate agency in New Jersey called New Jersey Family Care, and New Jersey Family Care determines your eligibility for Medicaid. That's a much longer process. Sometimes people wait 6 to 8 weeks, even longer, for their determination for Medicaid in New Jersey. Medicaid accepted all hospitals, most urgent cares. Here's the challenge with Medicaid. Although I will say it's the challenge across the whole marketplace, right? Medicaid is in-network only coverage, just like all the marketplace plans. So you have to use doctors or facilities that accept Medicaid in order to get the free services. If you're using a doctor who doesn't accept Medicaid, you're paying full price. And it can be harder to find. There are thousands of doctors who take Medicaid. And like I say, if you walk into a hospital, you're going to be fully covered. But it's harder to find doctors in private practice that accept Medicaid. Two ways to be eligible for Medicaid. You can be eligible on a monthly basis or an annual basis. If your annual income, these are current numbers, right? If your annual income is under $21,597 as an individual, or $29,187 as a couple, you'll be eligible for Medicaid for 12 months, or you can use your monthly income. So if your gross monthly income in the current month was below $1,800 as an individual, or $2,433 for a couple, regardless of your income the rest of the year, you can be eligible for Medicaid. In New York, we have another layer of coverage, right? Another tier of coverage above Medicaid, called the Essential Plan. The Essential Plan is pretty terrific. It used to have a premium and no longer has a premium. It's comprehensive health insurance. There's no premium. There's no deductible. One of the differences between Essential Plan and Medicaid is there are copays when you visit a doctor or you go to a pharmacy with the Essential Plan. The copays are modest, $15, $20, $25. At the pharmacy, $6 for generic prescriptions, $15 for brand name. Dental and vision are included and wrapped into the Essential Plan. Just dirty little secret, it's a lot harder to find a dentist who accepts the Essential Plan than it is to find a dentist who accepts, for instance, commercial insurance. But they're out there. The income limits, and I have a little asterisk on this, right? The income limits currently for essential plan go up to 250% of the federal poverty level, which for an individual is $39,125. If you're below that, you would be eligible for the essential plan. However, the top tier of income for essential plan, because of the federal legislation, because of that HR1 bill that passed in July, New York is shrinking or reducing the income limit for essential plan. Going forward, the essential plan income for an individual, I'm just going to pull out my income chart here so I don't mistake the amount. The income level for an individual is going to be $31,300 after July 1st. So it's that top tier of income is going to go away on June the 30th. So if you're eligible for essential plan right now, that under that top tier, that's going to be ending June 30th. And those income thresholds are going to go down. Essential plan, you have to be between 19 and 64. If you're under 19, you're on the Children's Health Insurance Program. If you're over 64, you're on Medicare. And you have to be a lawfully present citizen. You have to be lawfully present in the United States, which means non-citizens are eligible. Green card holders and visa holders are eligible for essential plan at this point. 12 months of coverage on essential plan. Again, if your income increases, you're obligated to report it to the state, but they're not going to change your eligibility. Essential plan provides what's called continuous coverage, and you can keep it for up to 12 months. Except, like I said, that top tier, if you get into essential plan now at that top tier of income, you're only going to get 6 months of coverage until June. If you're not eligible for Medicaid or the essential plan, you'll be eligible for a qualified health plan. These are the ones named after metals: bronze, silver, gold, platinum. These vary, by the size of your household, the carrier you choose, the insurance company, which county you live in. You may be eligible for a discount or not. So the prices, the costs, and the coverage vary on these things. I'm going to talk a little about this discount. When you file the application on New York State of Health, you declare an income. You say, I'm going to make $50,000. And once you declare an income, they may give you a break on the price of your premium. They give you a discount based on your income. You have to think of that discount, though, the way the government thinks of the discount, right? You tell them you're going to make $50,000, they're going to give you a discount. Next year, when you file your taxes, if you actually make $50,000, the government is very, very happy because they gave you an appropriate discount based on what you told them. But if next year your income has shifted and when you file your taxes you make $150,000, then the government's going to get very upset with you and they're going to come back and say, hey, you told us you were going to make $50,000. We gave you all this money to pay your health plan premium. You owe some of that money back, right? So that discount that you're getting, if you're getting a discount, it has to be reconciled on your tax return next year when you file your taxes. So you have to be careful. This is incentivizing people to be accurate, and you should be accurate with the income you declare on, as accurate as you can be, with the income you declare on the application. And you should be mindful of your income. If you're receiving a discount off the premium price and your income starts to shift, you can always go in and update your application, and you should, in order to mitigate your risk at tax time. I know that can be confusing, and it's a lot of work, but it is important to do that because people do get sort of burdened at tax time and they get a tax bill they're not expecting if they're not paying attention. There is a way to estimate your discount in New York. This is the screen. I just captured a couple of screens. This was from this screen share. The screenshot, by the way, is from before. This was probably before open enrollment in New York, or before they changed the premium price for 2026 anyway. So I put in some data here that shows an individual making $40,000. They were getting $727 per month off the cost of whatever plan they choose. That is significantly reduced for 2026. I would assume it's come down. I haven't looked at it lately, but I would assume it's come down probably to the $500 to $525 range. So it's quite a bit less. In New Jersey, New Jersey has a similar tool. I put in the same specs here in New Jersey. I put an individual in Passaic County at $40,000, and they were going to get $237 off the cost of their plan. This has also gone down, but New Jersey kind of kicked up. New Jersey also kicks in a little bit of a discount for you. So, uh, but it's still gonna, I don't know what it is now, but it's less than 237, I'll tell you that. Different levels of coverage. I mentioned bronze, silver, gold, platinum. Don't get roped into thinking like the bronze is the worst and the platinum is the best. That's not really the way it works. It's really the cost sharing and what the money that's involved. So you see on this chart that the bronze and silver plans have lower monthly premiums, but they have much higher costs when you're getting care. They have much higher deductibles, higher cost sharing, higher copays, etc. As you move up the metal levels, the premium goes way up. So the platinum plans are very, very expensive, but the cost when you get care goes down. So the deductibles are, all platinum plans in New York, I think, have a $0 deductible. Oh, whoops, I went the wrong way. Sorry. So when you get there and you're choosing, when you get to the bronze, silver, gold plans and you have to choose a plan, how do you do it? What are the things you consider when you're choosing which level to be at? It always, in my opinion, comes down to cost and coverage, right? What can you afford on the market? How much can you afford to pay for a premium per month? And then does your doctor take the coverage, right? So if your doctor is in network and the plan is affordable, it's a great plan. If the plan is free, but your doctor doesn't take it, then there's a difference. Or if the plan costs a lot of money, but your doctor's out of network, it's not worth it, right? So you have to think of how you're using the healthcare system. Are you generally healthy and you see a doctor once or twice, or are you managing more serious conditions where you have to, more serious stuff, you have to stick with certain physicians? You have to think about all of that, right? The cost and the coverage. That's going to direct your choice. If your doctors are in network with certain companies, that's going to be a very, very important determining factor as you choose a plan. Other things you can look at, silver plans really are designed to give you the most bang for your buck. Silver plans have, depending on your income threshold, can have these baked in savings. You don't really see them up front, but they can have much lower deductibles and different cost sharing. Always wise to take a look at silver plans. And please don't gravitate to, brand name insurance companies. You'll see them on the New York marketplace. For instance, United and Anthem are there, and it's wise to take a look at those plans. But there are other names that will be less familiar to you. You should look at all the different carriers. If you're still uninsured after all this, there are still resources in New York. People wind up being uninsured after open enrollment and don't have a qualifying event. What do you do, right? There is NYC Care. NYC Care is a system. It's mostly used for immigrant populations, but it can provide care to any New Yorker, emergency care. So it's wise to keep this on file in case you need it. Also, the big public hospitals in New York, the Health and Hospital Corporation. New York has 11 big public hospitals. In Manhattan, they are Harlem Hospital and Bellevue. In Queens, it's Elmhurst. Every borough has, I think, two hospitals that are public. Wise to use that system and go into that system. In New Jersey or other states, you can check a website called essentialhospitals.org, another place to find care if you're out of state or not in the area. A couple of resources about prescription drugs. A lot of folks know GoodRx. Less folks know Single Care and Cost Plus. But if you're taking prescriptions and you need to save money on your prescriptions, it may be wise to look at a couple of these websites. So Needy Meds and GoodRx and Single Care all offer sort of discount and discount coupons. They will also tell you where in the area is the lowest price for your medication. So you enter your medication and we'll show you the different pharmacies that are in the area and what the price is at those pharmacies. Another site I really like is Cost Plus. Cost Plus has about probably 3,500 to 4,000 drugs on it right now. They buy drugs directly from the manufacturer, so they don't go through the insurance company. They buy drugs from the manufacturer, they put a small markup on the drug, and then they sell it directly to consumers, hence the name Cost Plus, right? You do need a prescription. You have to file the prescription from your doctor on the site, but you can usually get, especially generic medications, at a very good price. Needy Meds also has a list of free and low cost and sliding scale medical and dental and mental health clinics all around the country. It's a really great resource if you're on tour or shooting in another location and you need routine care. It might be a really good resource, needymeds.org. This is a screenshot for on single care, a drug called Lexapro, and you see the different prices at the different pharmacies that were listed here. I think I also did, this is Lexapro on Cost Plus. This is what the Cost Plus website looks like. The Entertainment Community Fund, has in its building right here on 7th Avenue and 49th Street, we have a primary care facility called the Friedman Health Center for the Performing Arts. We were honored by the Tony Awards in 2024. We have 4 primary care doctors. We have a sports medicine doctor. We have a podiatrist on site. We're adding an OBGYN in March. We also do ENT and orthopedic referrals. We take all the union coverages. We take a lot of employer plans. We take workers' comp. We take Medicare. We do take one version of the essential plan, the Health First Essential Plan. And on the marketplace, actually, this has to be adjusted. On the marketplace, we take Oscar, Health First, and Emblem. We no longer take Anthem, Blue Cross Blue Shield. So that's a mistake on these slides. I'll have to adjust that. Anthem and Mount Sinai are in a dispute. We are a Mount Sinai clinic that we run with Mount Sinai doctors. Mount Sinai is no longer going to be taking certain Anthem products moving into 2026. Also, if you have coverage from Equity League, Actors Equity, Equity League, or Local One, the Stagehands Union, there are no copay visits at the Friedman. You get your copay waived by the Union Health Fund. If you're uninsured or underinsured, we have a subsidy program at the Friedman. You can get up to 3 subsidized office or telehealth visits for $40. You have to meet an eligibility test. You have to show that you're in the industry. You see the eligibility criteria there on the bottom of the slide. You have to have industry income in 3 out of the last 5 years. But we can assess you for that, and you can have a wellness visit. And the lab work is also donated by a place called BioReference. We got a grant this year from an actress named Tova Felsha, who is a New York actor. She gave us a grant to provide services for women who are uninsured for early detection screenings of ovarian and other reproductive cancers. So if you're uninsured or underinsured, or I'm sorry, if you're uninsured and you work in the industry and you have to meet this, it's a little more of a forgiving income test here. You can get a free cancer screening at the Friedman. Okay, that's it. That's the end of the presentation.